Good morning, everyone. The Committee on Budget and Government Operations is called to order. We have one item on the agenda today, and that item is a communication from the Office of the Mayor, an ordinance concerning an amendment to the Annual Appropriations Ordinance Year 2019 within Fund 925, which is the city's grant funds for the Department of Cultural Affairs and Special Events, to the Department of Public Health, the Mayor's Office for People with Disabilities, the Department of Family and Support Services, the Chicago Police Department, the Department of Business Affairs and Consumer Protection, and the Department of Transportation. Ordinance number 02019-4098. We do have a substitute ordinance. Can I have a motion to accept the substitute ordinance? Moved by Alderman Silverstein. All those in favor, say aye. Opposed? So we'll move on to the substitute, and we will have the Deputy Budget Director, Latoya Vaughn, from the Budget Office. She will describe the changes in the substitute ordinance, and then she will describe the ordinance. Ms. Vaughn? Before Ms. Vaughn gets started, I just wanted to let the members of the committee know that what I'm attempting to do is to try to give you more information, to be more transparent about the grant funds. So you will see that you have a report that defines what department, where the grant funds come from, how much those grant funds are, the areas of the city impacted by the grant, and how that grant is going to be used. Ms. Vaughn?
Good morning, Chairman Dowell and the members of the committee. I'm Latoya Vaughn, Deputy Budget Director with the Office of Budget and Management. I'm here to present the 925 grant amendments, as well as provide a brief overview of the programs. The department's subject matter experts are also in attendance and can provide additional programmatic details as needed. This 925 amendment request is requesting the authority to accept and expend an additional $6,822,000 in grant funds from various federal, state, and private agencies. The Mayor's Office is requesting a new grant in the amount of $132,000 from the John and Catherine MacArthur Foundation. This is to support the police reform program. Funds will be used to renew support of the senior staffing, to design a gun policy agenda, and to contribute to other community safety reforms. The Department of Cultural Affairs and Special Events is requesting a new grant in the amount of $150,000. These are private funds from the Bayless Foundation. The grant is Chicago Theater Millennium Park Summer Residency Program. These funds will be used to support programmatic and grant purposes. These activities include theater performances, writing workshops, and youth performances. The Department of Cultural Affairs and Special Events is also requesting a new private grant in the amount of $40,000 from the Allstate Foundation. This grant program is to support Youth Arts Festival for Rising Star Awards programming. These funds will be used for programming expenses and such as stage management and audio and visual controls, event support, and it will be to provide 35 ceremonial awards. This is an official letter that will be signed by the mayor and presented to the youth. The Department of Public Health is requesting additional federal grant funds in the amount of $1,539,000. The source of these funds are from the United States Department of Housing and Urban Development. This is to support the Housing Opportunities for People with AIDS program. These funds are used to provide housing assistance and related supportive services like referral services for low and income persons living with HIV/AIDS and their families. The Department of Public Health is also requesting an additional $380,000 in federal funds from the U.S. Department of Health and Human Services to support the Immunization and Vaccines for Children program. These funds will be used to provide vaccines for children, healthcare provider education, public and community education, vaccines distribution, and vaccine preventable disease surveillance and control, vaccine coverall level assessments, and perinatal hepatitis B case management. The Department of Public Health is also requesting new funds in the amount of $150,000. These are state funds from the Illinois Department of Public Health. The grant is the local health department overdose surveillance and response program. These funds will be used to collaborate with community clinics, treatment centers, and syringe exchange programs in high-burden community areas. These community areas include Austin, Humboldt Park, North Lawndale, and we provided a supporting report. These areas have been previously identified by the CDPH through their hepatitis C epidemiology profile. The Health Department is also requesting additional state carryover funds in the amount of $28,000 from the Illinois Environmental Protection Agency to support the solid waste management program. These funds will be used to conduct inspections in the following categories: landfills, transfer facilities, and solid waste complaints concerning illegal facilities and illegal random dumping. The Department of Public Health is also requesting additional federal carryover dollars in the amount of $82,000. These are federal funds from the U.S. Department of Health and Human Services to support the tuberculosis program. Funds will be used to provide home-based and patient support services as needed for patients at risk and or diagnosed with tuberculosis. Funds will also be used to enhance the clinical capacity to identify and treat more people within the high-risk community for TB disease and infection. The Health Department is also requesting additional state carryover grant funds in the amount of $38,000 from the Office of Illinois State Fire Marshal. These funds will be used to support the underground storage tank inspection program. Thank you. Funds will be used to provide support conducting inspections to underground storage tanks for compliance and issues needed permits and reports. The Mayor's Office for People with Disabilities is requesting an additional $41,000 in federal funds from the Chicago Housing Authority. The grant program is the CHA Home Modifications Program. These funds will be used to provide home modifications to people with disabilities and to make their living environments accessible. The Department of Family and Support Services is requesting new federal funds in the amount of $1 million from the federal U.S. Department of Health and Human Services for the Alzheimer's Disease Prevention Initiative. These funds will be used to implement training for Chicago area building managers and staff on Alzheimer's disease and related dementias. The caregiving program and also support the caregiving training program for families and caregivers, and to provide Alzheimer's train the trainer opportunities for the staff at senior services, senior housing facilities, and community and faith-based organizations. The Department of Family and Support Services is also requesting new federal funds in the amount of additional federal funds in the amount of $198,000 from the U.S. Department of Health and Human Services. These funds will be used to support the Early Head Start initiative, and funds will be used to support the cost of living increases for the Department of Family and Support Services, delegate agencies. Services under the Early Head Start and Head Start Program initiative support early Head Start childhood services such as daycare subsidies to infants and toddlers ages 0 to 3 and 3 to 5 years of age, as well as their families. The Department of Family and Support Services is also requesting additional state grant funds in the amount of $9,000 from the Illinois Department on Aging. This is to support the Elder Abuse and Neglect Program. These funds will be used for assessment, casework, and early intervention services related to elderly abuse and neglect. The Department of Family and Support Services is also requesting additional federal grant funds in the amount of $205,000 from the U.S. Department of Housing and Urban Development to support the Emergency Solutions Grant. This program supports the homeless prevention and support services, specifically towards the Rapid Rehousing Program, which provides financial rental assistance for up to a year in supportive services. The Department of Family and Support Services is also requesting additional federal grant funds in the amount of $28,000 from the Federal Corporation on National and Community Services to support the Foster Grandparent Program. These funds will be used to provide senior volunteers the opportunity to serve as mentors and tutors in the Chicago Public Schools and Head Start programs to children who have been identified as at risk of being promoted to the next grade level or falling behind academically. The Department of Family and Support Services is requesting new federal grant funds in the amount of $1,228,000 for the Head Start grant program. These are federal funds coming from the U.S. Department of Health and Human Services. Funds will be used to support cost of living increases for the Department of Family and Support Services delegate agencies. Services under the Early Head Start and Head Start program support early childhood services such as daycare subsidies to infants and toddlers ages 0 to 3 and 3 to 5 years of age and their families. The Department of Family and Support Services is requesting additional federal grant funds in the amount of $14,000 from the Corporation for National and Community Services to support the Senior Companion Program. These funds will be used to provide senior volunteers the opportunity to serve as senior companions to other vulnerable seniors and to assist them with shopping and light chores to allow them to continue to live independently in their homes. Seniors receive a stipend of $2.65 an hour. The Department of Family and Support Services is requesting additional federal funds in the amount of $3,000 from the state for the Illinois Department on Aging to support the state foster grandparent program. These funds provide matching support to the federal foster grandparent program, which provides stipends for 137 seniors for volunteer work with children in schools, and these seniors also receive $2.65 an hour. The Department of Family and Support Services is requesting an intergovernmental agreement for $50,000 to utilize InfoNet services. The Chicago Department of Police is requesting new funds in the amount of $254,000 from, these are state funds from the Illinois Criminal Justice Information Authority to support the law enforcement training program. Funds will be used to enable the Chicago Police Department's Academy decentralized training unit to provide 3-hour training classes in June for 700 to 800 sworn members in 2 districts to reverse opioid overdoses. The Chicago Police Department is requesting new funds in the amount of $38,000 from the John and Catherine T. MacArthur Foundation for the Safety and Justice Challenge Program. These funds will be used to provide 8 voluntary crisis intervention team training sessions to improve police response to mental health related incidents. The goal of the 40-hour basic CIT training are to help officers understand the signs and symptoms of mental health and co-occurring disorders, safely de-escalate individuals experiencing behavioral health crisis, and connect persons in crisis to treatment and community resources. The Department of Business Affairs and Consumer Protection is requesting additional grant funds in the amount of $83,000. These are funds from various cable companies to support the Cable Local Origination Program. These funds will be used to support 2 master control operators to support programming schedules for Channel 25 and the web, as well as other duties as required. The Department of Transportation is requesting new funds in the amount of $585,000 from the City Colleges of Chicago. This program is the City College's Public Way Infrastructure Program. These funds will be used to resurface the portion of 77th Street and Ford City Drive west of Pulaski owned by the City Colleges of Chicago. The Department of Transportation is requesting $197,000 from the Metropolitan Water Reclamation District to support the 10th Ward Stormwater Mitigation Program. These funds will be used for stormwater mitigation, installing 2 green alleys in the 10th Ward. The Department of Transportation is also requesting new funds in the amount of $400,000 from the Metropolitan Water Reclamation District for the Metropolitan Water Reclamation District Stormwater Mitigation Chatham Pilot Study. These funds will be used for a pilot study of stormwater mitigation in the Chatham neighborhood to evaluate potential runoff reduction and flood protection alternatives on residential properties. This concludes the 925 grant appropriations totaling $6,822,000.
Thank you, Ms. Vaughn. Are there any questions from members of the committee? Alderman Tunney.
Thank you, Chairman, and thank you for the elaboration of the disbursements and its effect on various communities. I have 2 questions. Number 1 is through the HOPWA funding, these are housing opportunities for people with AIDS. It's looks like about a $10 million annual. About how many families are individuals? And I'm assuming it's rental assistance?
Yes, we have data from 2018 because 2019 is still underway, but in 2018, this program served 31 families who received rental assistance.
What about individuals?
We do have a representative here
I
from
mean,
the
the overall approach, how many people are we affecting with these HOPWA funding? 'Cause
the
it's certainly in demand.
Yes. The department representative, Ayanna Thomas, can speak to more individual statistics. I only have statistics on the family served, which will be 31 as of 2018.
Okay, so hi, I'm Ayanna Thomas from the Department of Public Health. We don't have detail at this time, but we are happy to provide it about the number of people who've been affected. We have information on families, and we know generally that these services are available to families citywide who need them.
Right. Well, through the chair, could we get more detail on it? Because it looks like you're working with the AIDS Foundation of Chicago. Is that the only source of people administering this program?
Yes, that is the only
Okay. So it should be
agency.
simple to get.
So you're looking for individuals?
Yeah, just how many
number of
people on an annual
individuals
basis
served?
are affected by it? Yeah, families and individuals. It's a huge demand. So I'm just kind of interested to see if we're spending 10 million where it's going
Okay,
and how many
We'll
people
get
we're
that through the
affecting.
chair.
Great. And my other question I have is, in regards to the Alzheimer grant, since I'm seeing that this is the first time that we're finally recognizing that we need help.
This is the first opportunity that we've had for this particular grant program. Yes.
So we don't have to belabor this, but maybe the question is that I see in my community, and I think it's probably prevalent throughout the city, is that we have people that have various stages of dementia that seem to be abandoned by their families, and or individuals that are isolated, living in apartments, and that as their health deteriorates, this whole continuity of care to get people in not only their help with their memory care, but the fact that there's so much isolation in communities, and unfortunately, nobody wants to accept responsibility, or I shouldn't say nobody, but there's a real problem here. And the question I have is, so we have an independent individual that's failing in her mental care or his mental care. Where is the continuity of service? Because they come to our office for help, and this is definitely a national problem. And what are we doing in terms of providing care to our offices, is saying, we've got an individual that needs help, and what is CHA doing about it? What are we doing in terms of this continuity of care, because they're being left on the curbside?
And we have Joyce Gallagher here with the Department of Family and Support Services that can speak to those vulnerable populations, as well as the services that they're trying to provide as a whole.
Thank you, Alderman. And I know you've done a lot of work personally in this field. So years ago, under Age Friendly Chicago, we started to try to identify individuals who were in the stages of dementia and Alzheimer's. So we're using our 21 senior centers as lighthouses to find people in the community that are, suffering in this manner, and leading them to services through the Department of Family and Support Services Senior Services, which has federal funding. So in addition to that, the high-rise buildings, those individuals never, ever hardly see anyone outside of the building. So we applied for a grant through HHS to train building managers and staff to help identify these individuals and lead them to the services through the Department of Family and Support Services. So thank you so much for your support. It is a huge problem. Probably 25% of the seniors within the city of Chicago do find themselves in isolation, and this is one program where we can help identify them and bring them some assistance that they really do deserve. So thank you so much.
Commissioner, I always will call you Commissioner, because you've been at the forefront of this. I think the reality is that people have living, let's say high-rise living, okay? So they've been independent, and they've been working, and they've retired. They can't afford the rents in the apartment. They don't even know that they should be signed up with CHA. But then if they're signing with CHA, whether they're in a senior building or not, who is helping their memory care? Because it's expensive, and they've depleted their own resources, and the family is half in, half out, because it's a very expensive proposition, you know, for families too. And the question is, so we get the request, they're coming to our office because they're a month from being evicted or something. So when you find out the case, there's more to it than they're not paying the rent. And then, so your question, the answer would be go to the Levy Center or senior centers to really try to help them.
Right. What we're doing now is making them like a neighborhood base, an ability to go within your neighborhood to find assistance through the Department of Family and Support Services, Senior Services. So the Older Americans Act provides the funding. The community care units go out and assess the person depending on their own income, not their family's income. I think sometimes people get confused that it's their responsibility. They can help their families, but it's really the income of the senior themselves. And there are programs to help them. I think the hardest thing to do is once they become evicted to try to transition them into other housing. Supportive housing is a wonderful option for people. However, they don't like to give up their check for, you know, even though every need is taken care of. So it's an education process, and unfortunately people back into the problem. They don't really reach out and find out ahead of time exactly what services are available, but there are many and they can be helpful. I think the unfortunate part is with federal funding, you have to spend down your own resources, which is appropriate, but most people don't want to do that.
Thank you.
And also, Alderman Tunney, you mentioned the Chicago Housing Authority. For seniors that live in their buildings, they usually have service coordinators that are connected to many of the aldermen's offices and other services to help seniors that live in that particular kind of facility.
Great. Thank you. Thank you.
Alderman Wagisback, followed by Alderman Cappleman, followed by Alderman Smith.
Thank you, Chairman. Just a couple of questions on page 11. Could you tell me the total number of CIT-trained CPD officers? I see you have 21% there that would be trained that were trained at the end of June. And according to the grant's only $38,000, but if somebody could respond to what the percentages of trained officers at this point.
We have, the lieutenant to represent for the Chicago Police Department.
Good morning. I'm Lieutenant Antoinette Ursetti with the Crisis Intervention Unit. At the end of June 2019, there were approximately 2,854 sworn CIT-trained Chicago police officers. That represents approximately a 21% increase from the end of 2017, when there were 2,360 CIT-trained members.
And how many of those are advanced training versus basic?
This is basic CIT training.
And how many in CPD have advanced training?
I can get that information to you through the chair.
Thank you. And could you get so basically you're saying that of the several thousand other police officers, only 2,800 total are CIT trained in the whole of sworn personnel?
Yes.
Okay. I thought we had trained every officer in CIT training or at the most basic level as of a year or two ago.
The training that you're mentioning is crisis intervention training that is not part of the nationwide model. That's what we're talking about in terms of the 40-hour advanced. So every Chicago police officer has been receiving crisis intervention training.
Okay.
It's not this particular model of the crisis intervention team.
Oh, okay. Thank you very much for clarifying that.
Thank you.
My other question is on page 8 in terms of the abuse and neglect issue. for the grant. Can you explain how much of that goes to support for the investigators and any training that they would receive or specific type of training that would be helpful from receiving these funds?
Joyce Gallagher can speak to that.
Joyce Gallagher, Department of Family and Support Services, Senior Services. This is in addition to a grant we already have to be the regional administrator of the elder abuse agencies. They are contracted through the state of Illinois. So we are the regional administrators of that, but they do have a good program within the state to monitor this. Unfortunately, very few people actually do report, so it's the tip of the iceberg. Most of the abuse is family members, and the seniors are very hesitant to report that. So it is an ongoing program.
Okay. Thank you, Commissioner.
Thank you, Alderman Cappleman.
Thank you. On the second page of the substitute ordinance, the fifth item down, it says, whereas the city through DFSS has been awarded additional federal grants in the amount of $205,000, it's for the Emergency Solutions Program. Could you give more information exactly about that? Is that part of the Low-Income Housing Trust Fund, or is that wraparound service piece?
That is, those are entitlement funds that we receive annually from HUD. The Department of Family Support Services, Adrian can speak to that.
So you had it right the first time. It's Adriana Camarda from the Department of Family and Support Services. This additional funding is for rental assistance, so it is administered through All Chicago. So it is your rapid rehousing rental assistance that can vary anyway from 1 month to 1 year of assistance. And the way you can apply for these funds are either calling 311 and asking for short-term help, or you can come to the community service centers and apply for this funding, or through delegate agencies.
So it's not through the Low-Income Housing Trust Fund, it's just an additional funding
This is additional
mechanism.
funding.
I ask because the Low-Income Housing Trust Fund's in severe financial straits right now, and
No,
I'm
this is separate funding.
concerned. Like, I think it's $8 million deficit, so there's an issue there. It provides rental assistance for people earning less than 30%. Thank you. On the bottom of the page, it talks about CDOT awarding public grants, $585,000 to city colleges to be used for City College's Public Way Infrastructure Program. Could you give more detail on that?
Can we get Tom Carney with the Department of Transportation to speak to that?
Hi, Alderman. Tom Carney, Acting Commissioner CDOT. So the city colleges, Daly College did a major renovation upgrade, and this is the street needs restoration. But that over there is not public right-of-way. It's actually city colleges owns the land. They had gotten cost estimates from their contractor. They wanted to see if we could do it. The cost estimate we provided was slightly cheaper, so they're utilizing our in-house forces for us to do the work for them.
What's the address then? It's at, where is it?
This is out, like the Daly College is at like 7600 South Pulaski. The roadway is, it's not city right-of-way, but it would be if city right-of-way was 77th, for lack of a better term. It's like 77th, just west of Pulaski.
Great, thank you.
Sure.
And then one last comment, it's on the approved medical facilities. On the second page, I applaud the city looking at designated mental health intake facilities and arrestee procedures for people diagnosed with a serious mental illness and there's an arrest or non-arrest. It's actually requiring hospitals to take in these individuals. It's this document.
Sorry. Oh, that's the CPD item. I'm sorry. Can we get Larry Sachs?
My only concern is on that, on page 3 of 10, designated mental health intake facilities. There's nothing there that also asks them to record whether or not the person who is arrested or not under arrest is also experiencing homelessness. Is there a way that we can also include that too, that should also be documented? that if someone is arrested, arrestees and persons under arrest transported to facilities under this directive of department members will be accepted at any time on a no-decline basis. Can they also include to assess whether or not that person is experiencing homelessness?
Are you asking if the hospitals are able to do that, or if the Chicago Police Department
I
is
would
able
like
to do
to see the hospitals be required to, when they do assess these individuals, that they also assess whether or not they're experiencing homelessness?
We're involved with some partnerships where we are working with the hospitals and triage centers that are identified on there. We'll be more than pleased to bring back your feedback as we're working at strengthening our reporting and data collection.
Great, because right now, at this time, they do not. And we've had many patients, including in my area, who are homeless and who have a mental health issue and been picked up by the police. They're discharged back to the streets, and that's not helpful for them, not helpful for the community either. Thank you.
Thank you.
Thank you, Chairperson.
Thank you, Alderman Cappleman. Alderman Smith.
Thank you, Madam Chairman, and I also just want to start by saying thank you for the level of detail of information that's been provided to the committee. It's been very, very helpful. I just have a couple little questions. First, with regard to these Alzheimer's services, which is a wonderful program, I guess one question, follow-up I had is, how will the outreach be done to the high-rises? Because you are actually putting your finger on something that is absolutely true. Isolated seniors in condominiums or rental buildings, and they have nobody. How will you be doing that outreach?
Thank you, Alderman. We actually have a pilot of training prepared by the University of Illinois, Chicago. And we are working with the management companies, but we appreciate any help that this body can give us in, I guess, encouraging management companies to take advantage of this. But part of the grant is to hire a program manager and 2 trainees or trainers. So they will go building to building and provide this training, or work with the management companies and bring the managers into one location and be able to train them individually. And then we are also going to provide a video of the training that can be streamed. And Health and Human Services gave us the grant because of the pilot, because this does not exist anywhere in the country, and there's such a need for these building managers because they're the first point of reference for each of these individuals that is suffering from dementia or Alzheimer's. So we really do appreciate all of the support that we can get to make this program citywide.
So, don't know where you're doing the pilot, but please keep me on your list. We maintain, many of us, I'm sure, maintain lists of management people because we talk to them all the time about
Right.
constituent services.
Right.
And we would be delighted to try to push this training out
Thank you.
for condominiums and apartment buildings
Thank
as
you.
some kind of a,
So, I mean,
a program. We would love to work with you on this.
and see, you calling the management companies means a lot more than me calling the management
Right.
companies. So,
Right, we
Thank
would
you.
be, I'm sure there's many aldermen who'd be very happy to help with this.
Thank you.
You know, specifically at these multi-unit buildings.
Thank
So, so please keep me on your list and keep me, when something's about to happen, when you need something, please let me know, and I'm sure
Okay.
my colleagues do the
thank you,
same.
Alderman.
Sure. Thank you. And then just the one technical question I had, just to be clear, with regard to the Head Start funds, this is just, we got in the last round of budget hearings, the list of amounts to each provider, I seem to recall. And so the summary says it's just a cost of living increase. So I assume that the general amounts have stayed the same for the Head Start programs for the delegate agencies?
Yes, we have Tiffany Junkins with the Department of Family and Support Services.
Thank you.
And thank you, Alderman. Yes, the amounts
Excuse
have
me,
stayed.
could you say your name
And
for the record?
Tiffany Junkins, Department of Family and Support Services. And the amounts have stayed the same for our providers. For our Head Start program, each slot that we're paying out is about $8,700. And for early Head Start, it's about $8,600. And so on top of that, now they're going to be getting a cost of living increase
Is that
for
a,
each slot.
what does that amount cover when you say each slot is $8,700?
So we serve 10,987 children across the city of Chicago in various communities.
Right.
We also serve 1,583 early Head Start children, birth to 3 years of age.
And that's per child you're talking about?
That is a per child rate.
Okay.
And so the cost will remain the same.
Right.
They're just getting a cost of
Cost of
living
living.
increase.
Right. Thank you very much.
Thank you.
I have no further questions, Madam Chairman. Thank you.
Thank you, Alderman Smith. Before I call on Alderman Hairston, to Ms. Gallagher, when will this training program start for Alzheimer's? Is this something you are rolling out this year?
Chairman, there is a pilot training going on now. We're refining the training to try to get it down to a more manageable amount of time. So it is going on currently, if anyone is interested in it. We have a 6-month ramp-up of the grant, so it will start January 1st with the program manager and the 2 trainers. So then it will take off full force, but right now we are in the process of still training building managers.
Thank you very much. Alderman Hairston.
Thank you, Madam Chair. I still call you Commissioner, too. I have a number of high-rises, multi-unit buildings with a lot of seniors, so I would love to. I have a list of my management companies and would be happy to work with you on that. I think that is so key that we have this outreach program for dementia and for Alzheimer's. A couple of weeks ago, one of my staff had gone to a senior's house and basically detained him from leaving because she had that, and we had to follow up with family members, but it's really a concern, and so I would be happy to work with you on that. Question about the National Community Service Senior Companion Program.
Yes.
Okay, am I reading this correctly? The seniors receive a stipend of $2.65 an hour?
Right. That is not us. That is the corporation that provides that stipend because it's a volunteer program. So the stipend is literally just for their own expenses, and we do provide them lunch. However, the seniors are so dedicated and so committed to this program that some of them have been in a decade or more. And the services they offer, both with foster grandparent to the CPS students,
Right.
and the senior companion to individuals that are homebound, you couldn't create that even if you paid $1 million for it. So it's really the spirit of the seniors that are volunteering.
Oh, I just wanted to make sure I was reading that correctly. Thank you. The Rising Star Awards programming with Cultural Affairs and Special Events.
To hear
Can you tell me about the program and how kids were chosen?
Yes, my name is Tahira Baig from Department of Cultural Affairs and Special Events. So this is part of an annual program that we have, Rising Star, and it is honoring the teens of Chicago who do a good job in school. And so this is through CPS. Teens are nominated by the arts educator affiliated with their school or program. Each teen who is awarded gets a signed letter from the mayor's office for the recognition, and they're also listed on our website and an honor roll list.
Okay, you all don't, would you consider notifying the alderman when these are coming out? Because I'm not sure if there is a principal that does not nominate a child, then we might be aware of some students that should be nominated that a principal might not, they might just miss the deadline.
Oh, absolutely.
Okay, thank you.
Thank you.
Thank you, Madam Chair.
Excellent suggestion, Alderman Hairston. Alderman Osterman?
Thank you, Madam Chairman. I also want to commend you on providing all the information, which answers a lot of our questions for members of the committee. I do have a question for Head Start. The funding increase is federal funds. Do we get state funding for that program, and are we expecting any more funding given the state's passage of a budget?
This is Tiffany Junkins from the Department of Family and Support Services. We do not get any state funding for the federal Head Start program. It is only federally funded. However, we do get additional dollars through a different program through the state.
Will we be seeing additional funds at a further appropriation? Do you know yet?
We will be getting an increase to our, we call it the Illinois Early Childhood Block Grant. And we get those funds by way of CPS. They automatically receive 37% of the block grant from the state of Illinois, so we will be receiving an increase, but that's for a different program. It's our Preschool for All program, as well as our Prevention Initiative program, serving children ages 0 to 5.
So if you can, through the chair, when you figure out what we're going to get from the state, I think the members of the committee would like to know. And the last thing is more of a comment, and pass this on to CPS in your office, trying to make sure that the application process for that early learning for all is streamlined and parent-friendly, I think would be very helpful to help families get their kids signed up for the slots within the city.
Absolutely.
Thank you.
Thank you.
Thank you, Alderman Osterman. Seeing that we have no other questions from members of the committee, we do have one person signed up for public comment. That person will receive 3 minutes of time, and Mr. George Blakemore, you signed up for this item.
Previously, I was very critical of Carrie Austin, but she did have an item. You playing a game. You align the people to be able, for 3 minutes, to speak on about 20 items. You too play games. And it's a disgrace. Carrie Austin was a disgrace, and I see your operation. We welcome some fresh blood, but not this type. You're doing the same thing that Alderman Tunney. You're taking the public comment period away from the citizens. But you didn't put them by item. You're going to think you slick. You put them by where he is and all of that ordinance. You are just as bad. I told you, all of you, the black ones, the white ones, the Hispanic ones, that's terrible what you're doing. We always at budget, as bad as she was, as insulted and as arrogant, sometimes she wouldn't call you, but she had them itemized. How do you expect the public to be enlightened, informed, and to give you back information, each one of you, and transparent, when you gonna have it all with your slick self? Gonna have them all 20 items or more, as where it is. So you too, I'm gonna turn in to the Open Meeting Act. And they don't do their job either, because they politically connected. They didn't even want us to speak at city council. They had to go and sue. So just because I go up to Raul or whatever, his office, and tell him the scheme that you all are doing down here, that doesn't mean that he's going to change, because all of you work together and not in the interest of the public. Why would you change this format? Why you have all these items? Head Start. And one thing about Head Start, and I can name all the other ones too. Sometimes Head Start is not doing their job either. These vendors, you get that grant money, and you got no way to critique and make merit in what they do with this money. Some of them are Head Start to Cook County Jail, to the criminal justice system, black people. So you are terrible to do this. What motivated you to do this? Don't you want public participation? Number one, the timing is bad. At 2, what about the working people? I thought you would improve it to put it maybe at 5 or 6:30. No, you just as bad. All of you. And fake media, we don't have any media. We don't have any media. Defenders.
Thank you, Mr. Blakemore. Do I have a motion on the substitute ordinance, item number 1 on the agenda? So moved by Alderman Scott, recommending do pass. All those in favor signify by saying aye. Aye. All those opposed? The ayes have it. In the opinion of the chair, this item will be reported out at the full city council meeting on July 24th. Do I have a motion to adjourn? So moved by Alderman Taliaferro. All those in favor say aye. All those opposed? In the opinion of the chairs, the ayes have it. This concludes the meeting of the Budget Committee, and I want to thank the City of Chicago employees who took some time out of their schedule to be here today. Thank you so much for your time. Thank you, Ms. Vaughn. The meeting is adjourned.